Toronto surgeon Dr. CIHI was finally starting to feel confident his team was catching up on delayed and cancelled surgeries. Then came Omicron.
Our backlog got a lot worse again because we had to slow down.
The constant stopping and starting of procedures as COVID-19 caseloads rise and fall, coupled with burnout of healthcare staff and limited OR space, forced long delays for elective surgeries such as cataracts and joint operations. Even transplants and cancer care were set back. Close to 600,000 fewer operations were performed across the country during the first 22 months of the pandemic compared to 2019. But the latest data from the Canadian Institute for Health Information reveals wait times are starting to improve.
The challenge going forward, though, is hospitals are still being hammered by COVID waves. Our numbers are changing.
Behind those numbers are real people suffering. Marla Marshall received her liver transplant in December after waiting 11 months.
You're essentially just getting sicker and sicker and waiting on an organ so that you can live.
Jessica Bailey first spoke to Global last September and is still waiting on her kidney transplant.
The longer I wait, the worse my health gets.
Bailey's sister says her condition has deteriorated after testing positive for COVID on Sunday.
We are trying to preserve the status quo. We are trying to do what we used to do and think that we can solve the problem just throwing money at this issue.
Ottawa promised $2 billion to help with the backlogs, but many provinces say it's not enough. Public health experts say the solution has to come at a hospital level, designating some operating rooms for emergency use and others for elective only, adding more operating hours, and even distributing surgeries appropriately between doctors. CIHI says no matter the plan, time is not on our side.
Even if we're doing 110 or 115% of the usual run rate, you can see it's going to take us 10 to 20 months to catch up on the backlog.
Jamie Mauracher, Global News, Toronto.